Hello everyone, it's Schematic Med, and today we're going to talk about the diagnosis of multiple sclerosis. When we see symptoms like brainstem or cerebellar disorders, optic neuritis, internuclear ophthalmoplegia, and transverse myelitis, we suspect multiple sclerosis. If these symptoms are present, the next step is to understand if we have DIT or DIS. DIT is disseminated in time and DIS is disseminated in space. What does this mean? At first, this can be very confusing. If we have both, means we confirm multiple sclerosis and need to start disease-modifying therapy. If we don't have either of them, no DIT and no DIS, it could be clinically isolated syndrome. What should we do if we have only one of them? Before talking about that, let's try to understand what each of these means. Dissemination in space and dissemination in time are MRI diagnostic criteria. When we look at the MRI picture, dissemination in space means two or more brain areas are involved in a non-contrast MRI. We see lesions that are not only just one, they are disseminated in space. Space refers to the brain, and this means that we will have more than one deficit. It is understandable because if it is disseminated in the brain tissue, every part of the brain tissue is responsible for a certain function. So if it involves more than one part, such as 2 or 3 lesions in the brain, it means there will be more than one deficit. Mostly, it is periventricular or juxtacortical white matter lesions. When we're talking about dissemination in time, it means simultaneous active and chronic lesions. We will see this on contrast MRI. We will see one acute active lesion and one chronic lesion. The chronic one appeared earlier in life, and now there is another new lesion. Now let's come back to the question, what should we do if we have only one of these? For example, if we see dissemination in time, it means we had more than one attack. We can see one active and one chronic lesion. We need to find proof for dissemination in space. For dissemination in space, we need to see 2 MRI lesions that are in different sites. We need to do everything to find the 2 lesions. If we find them, it means we will confirm multiple sclerosis. What do we need to do if we have only proof of dissemination in space? We need to do the opposite. We need to find proof for DIT, dissemination in time, and try to find prior clinical attacks, or ask if there were any deficits previously. At the same time, we need to look for old MRI lesions. If they confirm, we can find the proof the DIT. Again, multiple sclerosis is confirmed. Thank you, bye.